It's a big panel, 6 people, we will try to get through as much as we can in the time available. I actually start with you, Sara. Maybe you could just set out and set the scene for us in terms of what is being recommended and the highlights of what's being done in terms of the Beating Cancer plan at an EU level. And then we can get into the details.
Okay. Hello, everyone. Good morning, and thank you very much for having me here in such a wonderful panel. And to talk about Europe's Beating Cancer plan, this has been one of the greatest achievements when it comes to health in the European Parliament, these mandates. And it hasn't been toned down with the biggest pandemic we have lived throughout the last 100 years. So the Beating Cancer plan was something that we worked very hard in the Parliament through a special committee in beating cancer, and we have followed up on the strategy by the Commission. This report was done by a dear colleague of mine, a late colleague, unfortunately, that passed away very recently, Véronique Trullet-Lenoir, which without her, it wouldn't happen as progressive and as ambitious as it is. It focused on prevention, and as we saw here in the testimony, the importance of prevention, early diagnosis, accessibility to treatment, and quality of life for both patients but also survivors and their families and carers. This is just the overall picture. I would like to reflect on something that is very important, and in less than 8 months we're going to have European elections and a new parliament will come in. And I must say that being a medical doctor in the public health field, I feel very frustrated at times because we understand that 40% of deaths by cancer could have been prevented, could be avoided. We know that we don't know 50% of the risk factors for cancer, so we need better research on that regard, and the EU is taking huge steps on that, and hopefully another big tool that will come out by the end of this legislature. I hope the European Health Data Space will allow us to have better data and information on these unknown risk factors. But I must say, on the risk factors that we know, we are failing to prevent them. We're failing to prevent them at the primordial level, meaning legislation. 10% of cancers are caused by air pollution. And just last week at plenary, we had the Air Quality Directive being voted, and it was very, very divided within the European Parliament's chamber. So I would like to raise this example because we talk a lot about beating cancer, but if we don't talk about the causes of cancer, we're still going to be in this endless cycle of just addressing the disease and not preventing it. And this is of the utmost importance, and this is also something that I think we need to reflect also for next European elections. Who do we want in the Parliament, and do we want people that are very much engaged into the prevention part, and what can we do at legislative part, or just focusing on the disease and how to manage it?
Okay, thank you, Sara. So that's sort of helping us set out. You've also set out something to do with your aspirations for how the plan should maybe adapt in the future. I want to look, because you've spoken at an EU level, but now let's have a quick gallop through some of the member states and reflect upon the implementation to date. So let me start with Lithuania, so Arūnas. What has been the experience of trying to implement the Beating Cancer plan in the context of your own national arrangements, and what do you see has worked, and what would you like to adapt in future?
Okay, thank you, Vivek. Hello to everyone. As we have had that, and we know that cancer is one of the leading causes of death worldwide, although the most cancer deaths are the main word is preventable. And malignant tumors rank second among all causes of death, both in European Union and in Lithuania. But you know, we, the people, do not like big numbers, big problems, especially if they are complex or common, demanding on give up to our own interests against name of society. Overall incidence of cancer in Lithuania is on a par with European average and affects a larger share of men than women. Therefore, Lithuania puts all its efforts to fight the disease and to cover the whole disease pathway. To ensure quality care for cancer patients throughout what I mentioned, the whole disease pathway, it's crucial to involve all parties. We have National Cancer Prevention and Control Program 2014-2025, covering all aspects, including prevention, early diagnosis, evidence-based treatment, palliative care. The current implementation plan aligning its implementation measures with Europe's Beating Cancer plan. The implementation plan is being updated each 3 years. And if we return to Europe's Beating Cancer plan, it provides an innovative approach to cancer prevention, treatment, care, tackling the entire pathway of the disease. It set out ambitious goals for all our member states. And, you know, all sounds good about our plans, but we should remember the words of Winston Churchill. He said, however beautiful the strategy, you should occasionally look at the results. That's why, taking stock of the progress achieved, I am glad that Lithuania is implementing quite a number of action according to the plan. I just name a few: HPV vaccination for girls and boys, alcohol and tobacco control policy, participation in various research projects, promotion of healthy nutrition. Yet to move forward and to achieve our goals, we need to increase better diagnosis, increase research activities, importance of prevention programs still is on the desk. But the main thing, there is a growing responsibility for decisions that ensure the vitality of the world around us. Life requires strategic decisions that affects not just one problem in a line, but all of them. And that means if our dream is to eliminate cancer as a cause of death, then let's do things from a holistic point of view. Let's do what makes sense, but not what is easy. I think this economist conference, this economist event, is quite a good momentum for all of us to talk about this talk of progress and identify the challenges what we still on our desks.
Okay, thank you. Thierry, can I ask you then, I said we were going to go through some of the countries, but France, I'm going to ask you a very frank question. Do you think that the Beating Cancer Plan has significantly altered or improved what you would have done anyway in France?
Yeah, I think it's clear. I would emphasize the significance of a well-structured action in the fight against cancer, and in that regard, the European Beating Cancer Plan is a remarkable milestone. I think it has provided the European cancer community goals, clear goals and purposeful goals, and relying a lot of stakeholders. I would insist on the importance of strategic planning on daily analysis. For example, in France, the French National Cancer Institute is responsible for implementing our 10 years strategy, which was devised between 2018 and 2020 and launched in 2021, the same year at the European Beating Cancer Plan. So it's very important, and we saw and we see that it allows us, it enables us to prioritize, to allocate resources where they matter most. But I think the question maybe for the EBPC, as we can see in France, is how to make sure that we can solidify outcomes. And the question is, do we have, in France or at the European level, of course, structures, networks that can help us to solidify that outcomes? But it's of course, it's a very great step in the fight against cancer at European level, as we understand. The European level can act as with an added value, complementing the action of the member states. But a lot of things must be done and should be done now, and we help and we ask, of course, and strongly support the renewal of the plan in 2024.
Okay. So there's some things that I might like to pick up there in a minute, but then, okay, now let's hear from Greece now, and what's your observations of the implementation in Greece?
Yeah. Well, thank you. I'd start, if the previous session was depressive, let's call this session hope. Mm-hmm. Because Europe Beats Cancer Plan, it brings hope across the nations. And the whole purpose was bring the equality into the cancer care around Europe. Now, I'll get a little bit of view on where we stand in terms of inequality. Last year was published the Registry of Inequality on Cancer Care. Mm. Now, we saw that some of the countries, and I'm going to come to the Greece, but we saw some of the countries, more Western, or even we heard from France or the northern countries, they have a good national cancer plan and good implementations. But in the countries where I'm coming from, which you say Greece, but I'm originally Slovenian as well, and more Eastern European, there are, like in country Romania, as I read it, a good national cancer plan, but implementation is taking place with a little bit, maybe, it can be addressed a little bit faster. Now, in Greece, although there is no national cancer plan, there are some initiatives in terms of prevention, and there have been some initiatives there, but yet there is a national cancer plan still to be established and a good implementation plan. What I want to address as well is two more points. When we have a good national cancer plan there and the good implementation as well, and I think a minister has alluded there, we need to measure the results as well. So because we don't know what we don't know. So if we don't measure results, if we are not looking what we want to achieve and how are certain indicators on the way to those results that we want to achieve it, which has been set either in the European Beat Cancer Plan or in the local national cancer plan. So what I'm trying to say is the importance of starting collecting the data. I think it was said already before, I think the minister has said, we need to start collecting the data that in order to have a good indicators and progress towards the results we would want to achieve it. And lastly, and I think, Sara, so the members of parliament from Portugal has alluded, and also some others, prevention. What we can do in prevention. So 40% of the cancers can be prevented. Yes, there is a lifestyle. We have in Greece, you asked me specifically of Greece, we have a stricter anti-smoking legislation, and we have done it also a lot of anti-smoking campaigns. There is vaccine preventable cancers also in Greece. We have gender-neutral vaccination for HPV to eliminate cancers, because we know we have Sweden as a country that they declared before year of 2030 they will have HPV-related cancers being eliminated. So I think in Greece we are progressing towards that, and as well as national screening programs. A year or 2 years ago we started, the breast screening program in Greece as well. So overall, I think there is still the gaps across the countries in terms of inequality disparities, and it's an urgency to put the policymakers together, put some resources, and build the comprehensive plans. But let's call it a hope is there. So.
Okay, that's very helpful. I'm going to forewarn all of the panelists. There was 2 questions I'm going to ask, and ask for very, very crisp answers to.
Yes.
Okay, so to prepare in your mind. One is the thing that you think the Beating Cancer Plan has helped you to achieve that you would not have achieved otherwise in the absence of the plan. That's one question. And the second question is, what is the thing you would like to see in the review of the plan? Okay, so you have a think about that, and I'll come back to you later on that one. But now I want to hear from Mark. You also have a role in the Lancet Commission, is that right? On oncology as well. Is that right?
That's right. That's right, Vivek. Good to see you again. Apologies that I'm not there in Brussels. Yes, no, I chaired the Lancet Oncology European Ground Shot Commission.
Yeah.
And what we did was we looked at to see what is and it goes back to the number of the speakers, we don't want to make decisions based on opinion. We want to make decisions based on data and data intelligence. So data should trump opinion. And that was really the premise that we had. So we did the largest, most comprehensive ever analysis of cancer research activity in Europe. And what we found was really interesting. What we found was that patients who are treated in research active hospitals have better outcomes than those who are not. So research is a necessity, not a luxury. So that was a key discovery. But the other thing we found was that then, what do we use that data for? How do we use that data intelligence? And that's really critical. So I'll just give you one example in relation to lung cancer. So lung cancer has 21% of the disease burden in Europe, and yet we only expend 4% of our research effort on it. So there's a disconnect there with what the burden of the cancer is and how we're actually trying to address that. So we came up with 12 recommendations how we could reimagine cancer research, but most importantly, its implementation. And one of the things that we're quite good at in Europe is discovery in terms of breakthrough, but we're not so good at follow through. And so one of the recommendations we're making is that we need to implement. And just to go back to one of the points that was made earlier in relation to inequalities, it's really important to capture those. We've started something through the European Cancer Organization called the European Cancer Pulse. And that collects over 130 different measurements from 34 countries right across Europe to address some of the inequalities. If we can't measure it, we can't do something about it. So it's really important that we use data intelligence. I sometimes use the phrase data eats opinion for lunch. So don't base your decisions on opinion, base your decisions on fact and evidence. And that's been really informative and again, has allowed us to come up with an overall strategy of what we call the 70-35 vision, 70% long-term survival in all European countries for cancer by 2035. Yes, that's ambitious, but we need to be ambitious in order to address cancer, which is one of the greatest challenges that we face in healthcare in Europe.
Okay. Thank you, Mark. I mean, a lot of you have raised this issue of actual evaluation and getting data that will allow us to stay. So that's maybe something that we need to discuss a bit more. Let me come to you, Vittorio. Thanks for your patience. One of the important aspects in the Beating Cancer Plan is looking at the overall experience of care, including things like palliation and including things like, really importantly, pain. I think those are topics that are close to your heart and your professional. So tell us about what you think has been achieved in those areas thanks to the Beating Cancer Plan and what we still need to do.
Yeah. Thank you for the invitation. Yes, my goal is to achieve the control of pain for every cancer patient. You think that in Italy we have nowadays 4 million people living with cancer diagnosis, and think that 40% of these people live with chronic pain. Chronic pain is also for survivors, for cancer survivors, is a goal to be achieved, because many times people living with cured for the cancer is outside the network, because outside the cancer network or outside GP practitioners' capacity of control pain. So there is a problem how to correct send these patients to the, for example, to the pain physicians. And this is an important goal to achieve. Palliative care nowadays are completely different from, completely different from 20 years ago, of course, because the cancer trajectory, the illness has completely changed. Now, palliative care has to be achieved during the active treatment of the patient, not only at the end. The end of life is just a little piece of the care, and so we have to extend palliative care, early palliative care, to every cancer patient. This is really important. Thank you. And talking about technology and innovation, because we are trying, for example, to use also artificial intelligence to give the possibility to a general practitioner to understand when a patient needs to be sent to the pain physician, for example, to palliative care physician. And we are trying to use also technology, for example, for pain surgery, which is a little piece of intervention that you can do to control pain in cancer. And for example, using metaverse in operating rooms, both for improve the intervention and to make a correct education, for example, far from the operating room, from the hospital. So we have students, university students in the room looking at the operating room intervention directly with the metaverse. Nowadays it's really incredible. This is the 2024 for Italy, for this field.
Okay, thank you. Any questions from the floor? Otherwise, I want to go back to those two questions that I asked earlier. Well, okay. All right. So, from each of your perspectives, something that the thing that you think has maybe that has happened that would not have happened in the absence of the Beating Cancer Plan that is significance. So maybe we'll start with you, Thierry. We'll just go in.
Okay. I would say maybe, but it's an ongoing action, the setup and the establishment of a network of comprehensive cancer center that we are working on for now and for the coming years. But it's a very, I think, impactful action, which was in the European Beating Cancer Plan. I think it's probably the most important to structure in each member state a very strong health system and the capacity to collaborate between member states. I think it's important. Regarding your second part of the question, I think finally there's a lot at stake at the European level. I don't know if each point must be in the renewal of the European Beating Cancer Plan, but I would say that to fight against tobacco is a priority. Prevention is a priority. We can hope and expect a more important role at the European level to fight against tobacco. It's, of course, the main cause in prevention of disease by cancer, diseases which are actually avoidable. Prevention, screening programs, and the way to diagnose early the birth of the disease. On drug market, I think there is a key point too. We are now in a quite weird situation. We have a European health assessment on drug access, but no price regulation. Regulation of the price is at the national level and I think that we have to think about European regulation on price, because it could provide us a solution tomorrow to provide better access to drugs, I think, in the European market. And at least, I would say that research is a key point, of course. We are all agree about that, but we have, at the European level, two tools, finally, actually. We have the European Beating Cancer Plan and the Mission Cancer at Europe, I think it could be better to integrate the research issue in the EU BPC in order to have a comprehensive strategy at the European level.
Mm-hmm. Okay, thank you. That's quite a lot there. That's very helpful. Okay, Arūnas, same question. Something that you feel that's happened as a result of the Beating Cancer Plan in Lithuania, and it could be the same things that Thierry, we've heard from Thierry, but what would you like to recommend for the review?
Okay, thank you. I will try to react and together it will be like a replica to our previous panel, because I see connection. Again, if we want to achieve a result, hope, and successful, and I am returning to the thing that we should understand what is the main success factor. The main success factor is cooperation of parties. It's ministries, healthcare institutions, insurance funds, NGOs, and all others. Second thing that we must cooperate through a whole disease pathway, and our strategies must include all these elements what we discussed later. But what we have today, a fact, today we have a situation that all things is fragmented in Europe. Existing cancer guidelines are not implemented across Europe. About 20% our countries haven't developed any national cancer control plan. But please remember, according to WHO, at least 1/3 of deaths from malignant tumors can be prevented by controlling of five main groups of risks. I'm not mentioning now it, but you know, the thing is always about strategy, about our prevention strategy, and our prevention strategy is not what we say it is. I would like to, that you will hear me. Our strategy is where we put our resources. And if a person thinks that all problems can be solved only with money, and there I remember our previous panel, then these people don't see problems. If you think that only money is enough to solve a problem, is not a problem. It is only an expense. The main success factor is the cooperation of all parties throughout the whole disease pathway. And success depends on these governments that are taking a holistic approach and implementing practical prevention plans covered all main factors: smoking, obesity, unhealthy diet, physical activity, infection, and air pollution, and others. That's my opinion. Sorry.
Yeah. So I think three things from my perspective. Try not to repeat it. So first thing, public discussion like that. That is right now after Europe Beats Cancer Plan. It's much more infrequent, than it used to be before. In Greece specifically, we are supporting on a yearly basis Economist event like that, discussing cancer management and what needs to happen and how we can progress in it. So first, I think, that brings the good public debate. Mm-hmm. Secondly, I would say, I think prevention is getting closer. We discuss about preventing cancer. We discuss about the screening. I think there are much more screening or discussion or the plans per member states. How can we screen more? Not only the three obvious, that was breast, cervical, and colorectal, but we discuss about lung screening, prostate screening programs, GI screening programs. So I think we discuss about prevention, vaccines, preventable HPV-related preventable or liver cancers, through vaccination. So I think it is debating like that, being in closer prevention as well, and the most important for me is data as well, because if we don't start collecting the data, we will not be able to measure. We will not be able to measure the results and the successes what we have. So for me, three things, So yes, those directions, prevention, data, towards the results. Yeah.
Okay. Thank you. And Vittorio, maybe you can speak from an Italy standpoint, something that's happened there. Yeah.
Just talking about prevention, for example, we are involving charity associations to bring the prevention, bring screenings on the field far from the big hospitals. For example, in Italy, we have disparities of access from the south of Italy and the north part of Italy. And so we are trying to develop programs taking screening on the field, in the areas, on the far areas of the south. And for example, our hospital with a charity association named Cancer First Aid, we are bringing, with the patronage of the Minister of Health, prevention on the field, far from the hospital. This is very important. And other question, talking again about quality of life of these patients, we have to raise the knowledge of the pain physicians and from oncologists about how is important quality of life and quality of care. Think that also, for example, malnutrition during cancer treatments makes impact on the doses, for example, of radiotherapy or immunotherapy or chemotherapy. And we are trying to make campaigns of better considering the nutrition during the treatment, for example. So we have to work all together, scientific societies, universities, and Ministry of Health. This is very important.
Okay, thank you. I'm going to go to our virtual panelists now, and actually I have further questions for both of you as well. But first of all, just let's answer this question. Sara, what would you like to see in the review, maybe? What would you like to see emphasized?
So in the review, I very much look forward for it, understand how much progress have we achieved at EU level, and I would like to see a greater focus on reducing inequalities when it comes to accessibility of care. We know that provision of healthcare is a member state's competence, but I also believe that together we can work and be more efficient in order to reduce inequalities when it comes to accessibility. And also I would like to see also some more action when it comes to prevention for the reasons I already explained in my introductory remarks. When it comes to, there's a lot that still we don't know, but within what we know, there's still a lot that needs to be done in order to address risk factors that cause cancer, increase health literacy of the populations, and better action in order to have better outcomes when one has to deal with the disease. Because after all, cancer is not an individual disease. It's a societal disease. It affects many, many different areas. And if we can reduce that burden in society, that's going to mean a lot of savings for member states.
Great. Thank you.
More importantly, for the patients and their families.
Okay. Mark, we've heard a lot about things that have happened in the aspirations. You feel free to, if you have anything you want to add, but I also want to ask how we evaluate. Because a lot of this stuff has been, a lot of our discussion has been around data and collecting evaluative data on outcomes and inequalities. How are we actually managing to evaluate whether the plan is working and whether it will work in the future? What do we actually need to collect, and are we doing it well enough?
Yeah, I think it's a key point. We need to set targets, we need to collect data to look at those targets, and then we need to use those targets then to drive better innovation for our patients. So we can't be just saying, oh, it's working well, we have all these initiatives that are happening. We have to actually measure what are they doing? What are they doing in relation to changes in access to treatments? What are they doing in relation to survivorship? So for example, we've 20 million, that's not 20 million Europeans who are living with and beyond cancer. what are we doing for them? We don't have a European cancer survivorship plan, for the example. The other thing that is key, and the only way this is going to work if it's taken up at national level. So one of the good initiatives that's happened is the creation of European cancer hubs, national hubs. And I think, again, we need to look at how do we translate what's happening at the large scale across Europe to individual countries. And we've seen in relation to how we dealt with COVID that we're able to work as Europe, but also as individual countries. So we need to take lessons from that and use that to drive our inspiration in relation to translating a lot of the good things in the Europe Beating Cancer Plan into better outcomes for patients. And I agree completely with Thierry's comment in relation to linking research and cancer control more closely. The mission and the European Beating Cancer Plan should be seamless between each other, and I don't think they are at the moment. So that's, let's say, a piece of homework that needs to be done. And the other thing to remember is we need to keep cancer at the top of the agenda. As Sara said, European elections next May, we don't want cancer to drop down the list. It needs to be top of the agenda as we go forward.
Okay, now, any questions from the floor? Oh, great, okay. I will keep quiet now because there's enough questions to keep us going. One at the back, and then you over there, sir.
Hello, my name is Fuat Beseli. I'm coming from Istanbul. We have oncology outpatient clinics in Turkey and Romania, Bulgaria, and some other countries, more than 60 sites. We have seen the Beating Cancer Plan document versions of it, but we still see a big gap between the authority and the industry, whether it's pharma for clinical trials and the patient advocacy group, and also the private service providers. In order to increase decrease the gap of all these parties and execute the Beating Cancer Plan, there still needs to be many actions to be done. So my question